So I came here to Lasair to get a treatment.
Yes.
Can you explain what we're doing today?
Absolutely. I'm very excited to have you come on this journey with us with NeoGen. NeoGen is a nitrogen plasma device, and it's going to remodel and reconstruct any of that skin issues that we deal with on a regular basis, whether it be pigmentation, some of the rosies, I call them rosies, the vascular issues, as well as creating those building blocks, those structural blocks that we need as we mature that are going to continue to hold our
face
skin
together
in place. Right.
I've seen there's multiple benefits. So is it pigmentation,
Right.
fine lines, crepey skin, collagen.
So it's going to create a collagen 1 and 3. And with new studies that have come out, it's also creating collagen 5 and 7, which is the vertical collagen.
Okay.
It's more of a structural. The NeoGen is going to create that brand new baby collagen cell. So it's not a collagen cell of your age or of my age. It's a brand new cell. So this is where the device opens up, and it's very beneficial for all skin types and for all ages. Some of the clientele I'm seeing now are 75 and older. We are taking care of ourselves longer, and we're more aware of what we can do to maintain it's not just about a youthful appearance.
We're essentially changing the skin.
Correct.
So we're making the skin healthier. So instead of, which is always a place for toxins and for fillers, there's always a place, but changing the health of our skin and then making ourselves look youthful. So changing the structural components of the skin so it doesn't wear off, it doesn't run out. We've actually changed.
Just like with you going to the gym, it's something that is needed. We need to nourish the muscles and we need to nourish the body. The face is no different. We do need to put it on a protocol that keeps things healthy.
And I would say too, is that as we get older, the muscles have always been there.
Right.
But as we get older, we just start seeing them more because our skin integrity changes.
Right.
So if you do tons of talks, it's great, but we have to focus on our skin because you're going to have always a missing piece if you don't focus on some technology for the skin. Right. Now, how does NeoGen work? So people are like, what is this exactly? Because when you say initially plasma, with my clients explaining it to my clients, we first think of PRP, plasma, blood, but plasma is different. Can you explain to me what is plasma?
Plasma is a fourth state of matter. It's everywhere around us. And with the NeoGen specifically, it is not a laser. It's a nitrogen plasma device. So medical grade nitrogen will go into the device. Ultra high frequency will pass through it in a quartz cylinder. This will ionize the gas and create a plasma energy. This plasma energy then will be introduced into the skin. So it keeps that epidermis intact. It denatures the epidermis. And as you heal, the skin underneath is safe because it's under this sort of biological wound bandage. And then that biological wound bandage will peel or slough off and the cells underneath are ready to be exposed. So it's treating all architecture of the skin. It's not fractionated like most other devices we are used to. It is 100% of the skin that we are treating. And I can actually go over the eyes without ocular shields.
That's great.
So I can volumize this area through here, the under eye trough and the nasal area.
The plasma renaissance, I was seeing some before and afters on how there was some volume that was appeared to have added to the face using this device, which is really quite interesting.
It is.
And I saw too, of course, today we're planning on doing a treatment and decide which level to do. So it's very customizable.
Right.
So can you explain how we can customize it based on your needs and your requirements for downtime?
Right. A lot of people in our lifestyles cannot have downtime. So we need to have a device or a treatment that we're able to treat in a series, but we'll have no downtime, low energy, no freezing, sort of a lunchtime kind of treatment. Or if you need to do the big bang, or you want the big bang, you want to take if you want 5 days, 7 or 10 day downtime. It's all available for us.
So, of course, if we're going to be doing something lighter, you'll need more treatments, and then going more extreme, more downtime, but less treatments overall, kind of getting to the same place.
We'll get to the same end. It's
place.
just a matter of how we're going to get there.
Okay, and then typically, so say if I chose a treatment that's kind of like mid-recovery, how many days recovery, what does that look like? And how do I treat my skin afterwards?
So for your healing journey afterwards is you will have that biological wound dressing that will turn a creme brulee color. We're going to call it that. Caramel sort of color to the skin before it peels. On that medium energy type of treatment, you will not cleanse your skin for 24 to 48 hours. We're going to continue to use products like I'm going to give you some Cytoderm, which is a sort of a silicone inclusive that will go over the surface. It's not for an inclusiveness per se like other devices. We just want to keep that from environmentally dehydrating. We want to keep that nourishment in. Because of the epidermis being denatured, it will become very dry. We just need to keep it hydrated.
So you have products to provide.
I will provide all of that.
And all the things I need.
Right.
I'm going to give myself an IV as well, so I'm going to hydrate my body from the inside out.
It's important hydration with NeoGen because it's chasing, not so much chasing water, but it is attracted to the water in the cell. So the more hydrated that cell is, the more energy it will take in and the better the result will be. So hydration pre and post is crucial with this device. It's crucial in your result at the end.
And we're going to be doing face and neck, I'm assuming.
Correct.
And then, but can you do it on the whole body?
Absolutely.
Okay.
Wherever you want to treat, we can treat, especially even, you know, I've been doing a lot of labia. You know, areas that are just maturity, menopause. There's so many changes in our bodies through this journey of ours here.
Yeah, definitely.
That we can keep things in a more youthful, healthy space, which is important.
As we've discussed, I have my diploma in non-surgical gynecology, so I do a lot of treatments for the female gynecological areas and needs. And I was seeing some before and afters, and I think that people forget that our skin, of course, we're losing 1% of collagen every year as we age, and then down there is also collagen. Down there's also collagen, so we still need to do things down there. So as much attention as we have up here, you're going to need down there as well, and there's going to be just increasing confidence and comfort and just overall.
In your step at the end of the day.
Exactly. And decreasing the taboo around that, and then lots of us don't know that these treatments are available. So
it's time we need to break that silence and be more open about it, because there's nothing wrong with wanting to feel good and to look after ourselves everywhere. It's not always about. I know that there's still a stigma about doing treatments. It's not about that. There's looking after our skin. Is looking after those lesions that may turn cancerous, looking after, you're able to recognize recently on our masterclass, when we were doing some of that vaginal rejuvenation, we diagnosed 2 women with autoimmune diseases.
Oh, wow.
And they had no idea.
I had no idea. I think overall, too, when I talk about it afterwards, like say if I did a podcast or an interview with someone, I would speak about it, and then afterwards I'd have a lineup of women almost like hiding behind the curtains and like asking more questions because they didn't know that this was ever an option, and they never had felt comfortable to communicate that with their typical, let's say family doctor, or they would have no options. So it's these kind of places and practitioners that you go to that have these technologies. So it's good to know that NeoGen's very good with that. When I was doing my diploma, they actually talked about Plexer, and they talked about NeoGen as a form for helping certain kind of conditions and presentations. Now with scars, what kind of, do you see any benefits with scar reduction?
Absolutely. Absolutely, because of scars, depending if they're hypertrophic, keloid, or any of those, both plasma devices, whether it be NeoGen or Plexer, they work in harmony together. They're very good at, scars need to have that dermis reconstructed, And it's not only is it about the top that we see, but we're able to minimize our visual. We're also able to create that density in underneath that skin to support.
Now, I currently have a Plexer, and then we're using a NeoGen. Can you, of course, describe, because lots of people are very new to this technology, what does the plexor do and what does a NeoGen do, and when is the time for one versus the other?
They marry very well together. I find the probably easiest thing to talk about is plexors in the epidermis. Plexors, anything that's raised on the epidermis, and laxity. A NeoGen is more of a dermal. NeoGen is a remodeling, resurfacing. It's going to help the structure, whereas epidermis is just dealing with everything, plexor is dealing with everything on the epidermis. They marry well together.
Yeah, definitely. I'm doing a lot of plexor shower recently, which people find benefit. Like,
huge benefit.
Like right after, and then just days after, like that was so easy. And what I like about NeoGen as well is that there's no needles. There's no needles. There's no breaks in the skin. Right. And how is
very
the
safe.
Comfort level? What's the comfort level?
So today I'm not going to numb you. We're going to be treating. We've discussed earlier that we're going to do a series. Of that lower energy. Your lifestyle is busy, and I understand that. And taking some time to schedule it in your calendar, it doesn't always fit. So it's probably easier for us to do that low energy, no downtime. So I won't be numbing you, and we will just, you'll feel like a warm blow of air. I'll show you when we get in there.
And there was a doctor that's talking about how sometimes he elects to do a lower energy one as the first one.
Right.
Is that probably
just to probably prep people, especially those that never really did much. Same with the plexor shower. It's phenomenal. Bringing people into this plasma energy world, understanding treatments, because I have a lot of people that approach that have never had anything done. And it's just education.
And so for people who are going to be watching this and interested in doing NeoGen, what are I know what the things are, but tell me, what are the steps that you have to take or preparation before? What are some things to avoid? What are some things to do?
I mean, recent son, obviously. I wouldn't come back from a vacation to get treatment. I would like you to stop actives for 2 weeks or so prior to it, and that would be your retinols, topical C, topical A's. Not that they interfere, but because it's a cell turnover with those products, and they're very beneficial to the skin. But with the NeoGen introducing the energy or the heat into the skin, we want to be able to take in as much as possible. Hydration, obviously you have been hydrating. I put everybody on 2 to 3 cups of electrolytes or mineral water or whatever is your choice per 3 days before and 3 days after. IVs if necessary, if you have, but not everybody has.
Just set myself up.
Obviously you're going to be mindful of
sun exposure afterwards.
I would prefer, if you're doing anything higher than your lower energies, not so much working out for a few days.
Allowing your body to recover.
You want your energy to heal here and not have to start healing other injuries to the body.
Not that with trying to avoid sweat. Is that important? Avoid
saunas,
sweat.
hot tubs.
No saunas, no hot tubs. It's important to mention those things because that's part of people's regular plan these days, right? And extreme hot or cold.
Extreme hot and cold. You don't allow this you're doing soft surgery. So if my mindset for a lot of my clients is, if you had day surgery, would you do it? And that just keeps them, that answers their own question at the end of the day.
Yes, and goes to the power of the device as well and what exactly is happening underneath the surface. And when would I be seeing the end result of this treatment? So say if you did a lower level treatment, when would I be seeing the result?
Start seeing some slight changes. Because the lower energy you want to do in a series of 3. Then you'll see some slight changes in about 30 days. There'll be a bit of a glow in about 2 weeks.
Nice.
And because it takes that cycle, 20-day cycle, to manufacture that new cell in the body, 30 days, you start seeing some slight structural changes. For me, I'm going to concentrate on your nasal fold. And your under eye trough. We always want to create this triangle. As we mature, we get this triangle. So I'm going to continue to volumize through the temple area. I'll concentrate on the upper part of the face. You have that chiseled jaw, so there's not a lot I can do.
I know, it's very strong, just very strong jaw. I found that with with weight loss, especially down here. I find that to be a difficult area.
We'll come through here.
And then
lift this.
And it's tricky for, of course, using things or regenerative medicine and biostimulatories are going to be first and foremost before putting filler in that area, because you're going to have an adverse appearance. It's going to just add volume where you don't want it. So it's more about helping the skin laxity.
Give it the tools.
Where there was once fat, now there is not. So that would be, this is a treatment for, people who have recent weight loss.
Yes.
A lot of my clients who are on peptides and, for example, who qualified for Ozempic, they're having some Ozempic face.
So there is a protocol for that, right? Every 30 days you're coming in and you're doing, it doesn't need to be a higher energy, but a lower energy, so we can continue to keep that structure.
All right, so let's get us ready.
I know. We're going to go in the room. We're going to get you prepped in a gown and prepped.
Great.
And we'll get started.
Looking forward to it.
Sticker, and this one is like a around the head, both backs. I don't know which one is.
Probably this will be more actually.
I don't play that game because I've done that in the past, and then she went, "Oh my God, I never noticed that." And it's like. Before you start the process, I want to give a little extra hydration to the skin. I'm going to put a nice layer of hyaluronic on your neck. Get prepared for our treatment. So I'm going to be starting Marie's treatment. This is the NeoGen device. What I've done is, as you can see, it shows. It's quite descriptive. I have 5% gas left. I have 8,000 shots left on my tip. I have 210,000 shots left on my armature. My energy that I've dialed is 0.8. I'm going to do 2 passes at 0.8. That is going to give you a couple days of downtime.
Okay.
Not major, but a little sloughing. I'm going to be treating at 2.5 hertz. It's fairly fast. And it's in ready to fire mode.
Okay, ready to fire, let's go.
So we're going to protect Marie's eyebrow. Any of her vellus hair will be singed. It's not burning, it's just singeing anything that's on the surface of the skin. You're going to hear a loud bang, and don't be alarmed by it. And you'll see this warm blow of air. When you open your eyes, you can see it. You see that energy? There you are, Lister. What are you feeling?
Just some warmth.
Is it uncomfortable?
No, it's pleasant.
Okay. Good. I'm just coming up Marie's eyebrows. And we can actually go over the eyelid without ocular shields. It's very unique and it's very beneficial because most people get some pigmentation on their eyelids, or as we mature, our eyelids get kind of rosy. They get that redness, the vascular. How did that feel?
Fine, good, thank you.
Good. So I'm just going to cover her beautiful lashes and come into the lower part of the eye. I'm going to open the corner here. And what I want to do, spend some extra time in the corner because I want to bring this volume. I want to volumize this. I want to volumize the brow, and I want to volumize the temple naturally. I'm going to come into your lower eye now. Too much? We can be honest.
I'm good.
Okay. Well, my main concern for the under eye is that I want to volumize it. I want to help with the skin texture. Are you okay with that 0.8?
Yeah.
Are you sure?
Yeah.
Okay, you're gonna go up now Just to aid again.
Just from the eyes, I think.
Yes, it's very sensitive. Anything you do on your eyes, right?
Yeah, more nerve endings.
Right.
Eye, the lips.
And it's kind of like the mind is going, hey, you're in there.
What are you doing?
What's going on? This is not cauterizing the vascular, it's diffusing. Sometimes it's much easier on clients that are very vascular. If we can diffuse the redness on the cheeks, it's a little less swelling and harshness through the healing journey. Some singeing of some of that vellus hair. That's natural. Get a little bonus dermaplaning, right?
I do dermaplane my face, but sometimes not my neck. So if they have current, because there's a lot of treatments that you can't do when you have acne, right? So you can't do microneedling, so this would be a great treatment.
This is a great treatment because it's antimicrobial, and we're going to do a lower energy. It keeps things comfortable for them. Sometimes we do notice that they have a bit of a purge, but once you get past the purge, everything is fantastic.
But necessary, purge is so necessary, right?
And then purge is necessary. It's already in there. It needs to come.
That's a problem, can't get out.
Right, we're going to make it get out, right. That's where I really want to concentrate, is this temple area. I'm going to elongate that.
Dislike the sensation because I can handle a lot of discomfort. My least favorite feeling is burny.
Okay.
Now we know.
Now we know.
Now you know I can do like needles and workout pain and cold and hot, but burny skin is
Burning skin is not a good thing for you. It's all right.
That's okay. You can handle it.
So next time,
Yeah.
we'll put half
Numbing
an hour.
is an option. Numbing is an option.
Numbing was an option.
Yeah.
It's going to help shrink pores.
And so the post-care kit. So what does that include and
So
how do I
that
use
has
it?
a Hydrinity HA serum. You don't not need to use that for the first. I'm going to give you some product called Cytoderm. Cytoderm is a silicone scar. See, I have a little scar right there. Okay. And one right there. So you can volumize them. We're creating that brand new baby collagen cell. So I'm going to elongate your mouth here. I'm going to open the corners of your mouth and I'm going to go in here. Because we always want to bring these out again. You can right up your nasal folds.
It's totally manageable. It's just that just to avoid any discomfort, you could use numbing.
Right.
Yeah.
Right. Easy peasy. For some women that do not wish to have fillers or are more of a natural look, we can actually do this right over the lips with the lower energy. It gives a bit of a lip plumping. It'll help hydrate the lips, nourish them. And obviously, I can't guarantee how much we're creating volume wise, but I do mine and just gives them a little extra because I don't do an injectable program.
Even too, like people don't think that the lips are going to age just as much as their skin's going to age.
Of course they do.
It's
They
also your
shrink
skin,
and
you're going to lose volume just as your face does, and lose collagen just as your face does.
This muscle here sinks in, right? So this is why I concentrate a lot here to bring the corner of the mouth back out in that lip flip or whatever they want to, what the name is that we're using now. I just want to bring these out. You have beautiful lips. And it's very interesting. This will creep up on you. One day you look in the mirror and go, oh my God, my neck is looking so good. It's nothing overnight when you're doing the lower energies.
Month-ish.
Month-ish, 6 weeks-ish.
So
We're going to do another one in a month.
I come back in a month, so.
Yeah. So we're going to be using Cytoderm. And what it is a silicone gel that's going to be applied to her skin now. This is what she's going to continue to apply over the next couple days. Looks great. Like it really doesn't look like you had much done.
No.
A hard workout maybe.
Hard workout, yeah. Yeah, just
Flushed, a little red,
flush
but
face.
this redness will flare and dissipate throughout the day. It's hot, not hot.
It's comfortable.
And next 2 hours, you'll feel like nothing happened.
Amazing.
Okay?
Yeah, it's very comfortable.
You're going to use this product. What we want to do is to keep you hydrated. Again, you're going to continue with your electrolytes and your water IV intake and keep the topical hydration.
Okay.
I'm going to give you some hyaluronic acid as well, that when over the next, your healing journey is going to be maybe 3 days. Once that starts to finish, with it might have a slight sloughing, you will then start on that HA product.
Okay,
And that's going to give some really good hydration to the skin and hold the hydration.
Okay.
Okay.
Thank you, Jen.
Your applications of product will be in a tapping sort of motion. We don't want to rub. We do not want to disturb this natural biological wound dressing that has started to affix from the energy going into the skin. It closes the door behind it and creates a safe healing environment for the skin underneath. There's no open wound.
Which is amazing.
Which is amazing. There's no risk, minimal risk.
What would be the risks or complications that could
Occur if the biological wound damage gets disturbed during its healing process. Sometimes the skin will be red longer underneath. It will always heal. If you weren't careful and something should happen, it's like any resurfacing device. When there is an open wound, we must be mindful of making sure that there's no infections or anything that happen if you're not careful. But because we have the biological wound dressing here,
keeps it all contained?
keeps everything contained, keeps you in a safe healing environment. Sometimes it happens with the higher energies that the biological bandage does get disturbed when we're sleeping or clothing. It happened in one of my videos. My jacket was rubbing during my healing journey. So that redness lasted probably about 6 weeks after, and it was just like it was not raw, but it was just irritated, kind of open reddish.
What would be contraindications to getting a NeoGen treatment?
Any implants like Dopplers, pacemaker, or a defibrillator. Also, any if you're lactating, pregnancy. If you're making a baby or feeding a baby, your body's busy, so you don't really want to create an injury that is going to cause another distraction to it. It's autoimmune diseases. There's 77 of them. So we need to decide what specific autoimmune disease a client may be dealing with and address what that looks like. Because arthritis, rheumatoid is an autoimmune. So I personally, you have to weigh your risks with that. If it's a full-blown, obviously you're not going to treat somebody in that zone. But we do have a lot of people with those diseases that we need to still treat them. That's about it. There's not a lot of contraindications for NeoGen. It's pretty much like the standard on any device. It's looking good, hun. Okay. Let me see how I just kind of put a little bit under that eye. We mustn't forget we did the eyes. We're just going to tap some in. Some in your lips. There you go.
Thank you so much, Jen.
You're welcome, honey.